major alert about the vaccines doctors give adults and children at their offices. ABC News was the first to bring you the startling results dug up by the nation's top investigators. Many of those vaccines are not being stored properly, which can render them almost useless. ABC's senior national correspondent Jim Avila tells us ever since the news broke, the CDC has been scrambling.
American babies are routinely vaccinated for 16 different life-threatening diseases. But as ABC News first reported, disturbing findings by the Inspector General overseeing work at the Centers for Disease Control show the country's vaccine supply is not being protected as it should be. The problem is here. Federal inspectors found that 75% of the doctors' offices and clinics they inspected had refrigerators that were either keeping the vaccines too cold, that's ice on this influenza vaccine, or too hot. Conditions that rob them of some, and in many cases, all of their power to prevent disease.
Clearly, doctors' offices ought to be re-educated about exactly how vaccines need to be handled.
Washington State is right now suffering a rare whooping cough outbreak, and the state health department says the cause is a mystery.
You don't think that has anything to do with bad vaccine?
We are looking into the situation in Washington State to better understand it.
A Baylor University study last year found many of the vaccine refrigerators in Houston exposed their serum to freezing temperatures and found a correlation between those frozen vaccines and an increased number of whooping cough cases. Could the same thing be happening in Washington State? Most experts say it's too early to tell, but one thing is clear: something has to change in the storage system that depends upon household refrigerators to store life-saving vaccines.
Lunches and other foodstuffs should not be housed in the same refrigerator as pharmaceuticals and vaccines. So you need a dedicated refrigerator for that, and you need to have that temperature of the refrigerator monitored regularly.
At your next vaccination visit, the CDC says it's a good idea to ask the doctor how his or her vaccines are stored. They'll know about the problem. The CDC today sent out warnings to state public health agencies and doctors around the country, reminding them of the importance of storing vaccines at the right temperatures. Diane?
So asking will at least raise a red flag to doctors. Thank you, Jim.